This is a 70-year-old woman who presents with the typical signs of age. Now that she's retired, she wants to look more fresher and rejuvenated, and she wants her external appearance to kind of match that. So these are the three objectives. Naturalness, number one. Number two, definitive result. And number three, longevity. So with her, what we decided to do was a complete rejuvenation of her forehead, which is the top 1/3 of her face, the face, which is the middle 1/3, and the neck, which is the lower 1/3. The way that we address the forehead is these days now, it's rare that I actually perform an open forehead lift, because a lot of the forehead lift now we can do it endoscopically, which means minimal incision, not just less scar, but quicker recovery time and probably more naturalness as well. So with her forehead, we did an endoscopic, what we call forehead lift or brow lift. And by not touching her upper eyelid, a lot of that rejuvenation looks actually more natural. In terms of the face and neck, we did what we call an extended SMAS and platysma facelift, where the lifting portion is concentrated on that fascial layer. That SMAS on the face and platysma in the neck. One of the goals of this type of surgery is, and especially with her, is you want to make sure that the face still looks soft. It doesn't look like it's been over pulled. So especially at the top portion of the face, what we want smoothness. We don't want too much stretch. But on the lower part of the face and neck, we do want more accentuation. Because over there, even if there is more pull and more of a result, you still look natural. In addition, she also had a lower blepharoplasty, which means lower eyelid surgery, to address the bags that she has. So this is a young woman who presented wanting more of a transformational change. So this is a patient who is actually quite model-esque. She's tall, but she was somewhat heavy. One of the things that we have to take into account is the fact that she is going to lose weight, and she said it herself. Obviously, the areas that we normally associate with accentuated features, the eyes and the nose, and facial contour. These are the three things that she really needed more definition. So let's talk about the eyes first. The thing that's more striking for her is the fact that she does have what's known as ptosis, or a lazy eye. Quick note about lazy eyes. It's something that is actually innate and very, very common in Asians. And that lazy eyes doesn't just mean that you don't have a double eyelid. It actually means that there is a weakness of a muscle that we utilize to open and close our eyes. One of the things that we do when we perform a double eyelid surgery is not just creating that double eyelid, but also tightening that muscle so that the eyes open up a little bit more. It's what we call ptosis correction. The other thing that we did with her, obviously, is the nose. If we take a look at her preoperative photo, she's got kind of a usual standard Asian nose, which means just overall it's small in terms of the height, the definition, and what we call the tip projection. As far as augmenting the dorsum, we decided to go with a Cortex implant, EPTFE. And then for the tip, we utilized a combination of ear cartilage along with septal cartilage. For a lot of non-Asians, sometimes what we want to do to make the nose look a little bit more cuter, a little bit more feminine, is we sometimes raise up what we call the tip angle. However, for most Asians, because there is a good amount of nostril show anyways, What we actually want to do is change the direction of the tip projection slightly down, but more forward. Out of all features of her face, I mean, she really likes the nose the best. Finally, another very important component is the bony contour. If we look at her preoperative photos, I mean, obviously her face is rounded and somewhat full. We can make a dramatic result if the patient chooses what we call a reduction mandibulopectomy. And what that means is we resected a piece of the mandible, especially at the angle, and we also reduced the width of the mandible as well. Now, this type of transformation certainly is not for everyone. Most people don't want to look completely different. However, in this patient who is in that profession where she needs to be in front of camera, that she did want more of a dramatic result. And certainly as us as plastic surgeons, we have to listen to what the patient actually is requesting. This is a 62-year-old male who's kind of typical in terms of how he presents in terms of like aging process. He feels like over the last several years that he's looking tired. You know, he looks older. And usually in men, it's usually the lower eyelid that tends to show first. And so what he has is that he's got bags under the eyes. And that's probably the first thing that kind of shows. Along with kind of early signs of aging in the lower part of the face. So with the bags and the lower eyelid aging, we do what's known as fat transposition, which means we take the fat and then we don't just remove it. We use the fat to kind of move it down into the tear trough region, which is the hollow region. And that makes the whole area look more smoother without looking actually hollow. Because that's one of the things that we do worry about, is that if we take out too much fat, then it can look a little hollow. In addition, we take out some of the extra skin and we do a supporting procedure, which means we tighten the end of the lower eyelid, because one of the things that we do worry about when we take out the extra skin is the possibility of it migrating down. And so by tightening the end of the lower eyelid, it prevents that from happening. This is a 50-year-old woman who has the kind of the early signs of typical aging, which is number one, around the eyes, and then the second, the sagginess on the lower part of the face. So around the eyes, the typical signs of aging is the upper eyelid hooding, which means the upper eyelid skin is migrating down, along with the bags under the eyes. So a lot of times whenever we see the sagginess of the upper eyelid, it's usually a combination of extra skin in the upper eyelid, but a lot of times more important than that is actually the eyebrow descending down. And the reason why the eyebrow descends down is because the forehead drops as we get older. So with her, what we decided to do after discussion was we did what's known as an endoscopic brow lift, which means using minimal incision technique, we elevated the entire forehead. And what that does is that it makes her eyes look fresher without really touching her eyes. Okay? And a lot of times that's actually sometimes more natural. In addition, she has the bags under the eyes. So what we did was we took some of the fat that was herniating out, and then we moved that down to the tear trough region, which is the hollow region just underneath the bag. We also took out some extra skin, and we tightened the end of the lower eyelid margin. In addition, because of the sagginess of the lower part of the face, we did a minimally invasive mini facelift, and our version that we coined the term wave lift. And what that means is through a small incision, and that incision is sort of confined to the upper part of the face, We make that incision and then we insert an endoscope or a camera to help us dissect under the muscle and do the lifting. It is a minimally invasive, which means small incision with faster recovery time. And what it does is that it really does truly help rejuvenate the lower part of the face. And because we're actually manipulating the muscle, the result actually looks more natural and more longer lasting. So this is a 62-year-old female who presents with signs of aging. And overall, what she has is she has just overall kind of sagginess. In addition to that, she also has some volume loss as well. Because aging is not just about sagginess, but it's also volume loss. So the plan in her was a complete facial and neck rejuvenation, along with fat grafting to the parts of the face that needed more volumization. So whenever we take a look at the face, we look at and divide the face into three parts. The top 1/3, which is the forehead, the middle 1/3, which is the face, and the lowest 1/3, which is the neck component. To kind of break down what we did was, for the rejuvenation of the upper 1/3, we did what's known as an endoscopic brow lift or an endoscopic forehead lift. We use that terminology kind of synonymously. And what we're doing is, through a minimal incision beyond the hairline, we're elevating the entire forehead up. And obviously it's very important not to overdo this, but at the same time, you have to do enough so that it's not just the forehead component that we're addressing, but the upper eyelid sagginess as well. And so when we do an appropriate lifting through the endoscopic brow lift, the entire 1/3 of the face looks very naturally rejuvenated. For the middle and the lower part of the face and the neck region, we have to do what's known as a face and neck lift for her. Because like I said, there is a way in which we can do a minimally invasive facelift, but she also has pretty heaviness of the neck as well, and she wanted a complete rejuvenation. The goal usually for a face and neck lift is, on the lower part of the face as well as the neck, we want to be more aggressive. Because no matter who you are, the cleaner the jawline is and cleaner the neck is, you still look natural, but you look much more rejuvenated. On the top part of the face is where we want to be a little bit more cautious and natural, because it's really in that mid-face, top portion of the face, where if you pull too much, then you get what's known as a windswept look or an unnaturally kind of cold look. Then we addressed the bags under the eyes. So we did a lower blepharoplasty. And in addition, we injected some fat into various parts of her face that needed some volumization. This is a 50-year-old patient who comes in asking for rejuvenation of her face. She feels like over the last 5 years, she's gotten significantly sort of more older. And one of the aging process that occurs is that it gives you an impression of looking sad and tired. If we look at her before photos, the thing that is most prominent is the nasolabial fold, as well as her marionette line, which is at the corner of the mouth. And those two areas are where people start looking sad because there is droopiness to those areas. The other thing that's prominent is her jawline definition is lacking. So she's got what we call jowls. And so these are the kind of things that we want to address. And especially in the lower part of the face, we do want to be somewhat aggressive, because for everyone, the cleaner the jawline is, the better that they look. And so with her, we did a face and neck lift. And then the other thing that we did was chin augmentation. So let me talk about the face and neck lift and the result that it achieved. As you can tell here in the after photos, the nasolabial fold is significantly softer. So the goal here is not to get rid of the nasolabial fold completely. It's about softness, because without a nasolabial fold, people look unnatural. But it is down here at the marionette line that we do want to get rid of it completely. So as you can see in the after photos, she's got no marionette line. And the jawline definition is sharp, okay? And that's what we want, is that the cleaner the jawline is, kind of fresher that person looks. And that is sign of youth. But you want to maintain naturalness on the upper part of the face, especially in the cheek area. So the whole goal in the cheek area is all about softness and smoothness. And if we can kind of take a look at her other photos, you can see significant changes, especially at the definition of the jawline, as well as the heaviness across the marionette line. And in this angle, you can truly see how clean the jawline is and how we actually did get rid of that marionette line. The other prominent thing that we did was put in a chin implant. And we can clearly see in this side profile how set back the chin is, because the chin point should be in alignment with where the nasal upper labial junction is. And it really should be at around this point. And therefore, by achieving more of an anterior projection, there is definitely a better harmony to the face. Overall, I think in terms of improvement here, not only does she look younger, but she just looks overall fresher, more vibrant. And that's what we're looking for when we're doing a facelift. We're not trying to change who you are, but we are trying to make you look more fresher. And it truly is about dialing back the time. This is a 61-year-old woman who presented seeking some sort of treatment for rejuvenation of her face. She certainly didn't want to change who she was. She wasn't really looking for a dramatic change. She just showed us a photo of how she used to be when she was in her 40s, and she was hoping that she would get kind of close to that age. She definitely needed lifting of some sort. And we performed an endoscopic brow lift, face and neck lifts. That's a total face lift. In addition, her neck was kind of heavy, so we removed some of the fat there, and we really wanted to delineate and define that jawline, which I always think is so important. One of the main things that we really did with her was we elevated her eyebrow, but we didn't really change the eyebrow shape. With her, she definitely did not want an arch. And then we performed an upper blepharoplasty to just try to make the eyes more even, more pleasant looking. Now, if we kind of focus on her, there are several things. Number one, for eyes, there's nothing more important than symmetry. This is her left eye, and this is her right eye. Her right eye is not too bad, but it's really her left that requires a little bit more of detail, because as you can tell, her left eye is a little bit smaller than her right. And it's not just about the fold, but it is about what we call vertical aperture. How much of the eyes really show up on a non-expressive, normal type of eye opening. And she does have some degree of what we call ptosis, which is that weakness of the muscle that occurs. For a lot of Asians, it's actually inherent, but it also occurs as we get older. And so one of the things that we did is some ptosis correction. If we take a look at and focus just on the eyes, you can tell that the left eye now looks more brighter. But that brightness doesn't come from just making the double eyelid more symmetrical or more bigger, but it's actually doing the ptosis repair so that her eyes open up and it gives that shyness to the eyes. The next thing we did was we removed some of the bags under her eyes. And one of the things that we do certainly is for aging lower eyelid is not only do we just remove the fat, but we actually do what's known as transposition, which means we move the fat from the full area, where the bags are, where the fat protrudes out, and then we utilize that fat to move it down below to fill in the hollowness in what we call the tear trough area. As I stated before, for the upper part of the face, one of the main things that we want to accomplish is we want to make sure that that area is as smooth as possible, because that's a sign of youth. And so fat transposition, I think, is one of the more important things that we do when we perform lower eyelid surgery. As far as the face and neck lift is concerned, the goal here is to try to eliminate this marionette line. And with her, even with her smiling, that there really is not much of a marionette line. The other thing that we did was we tried to define the jawline better. And as you can clearly see here, that the jawline definition is certainly much more sharper and smoother. What I see is a mistake for a lot of facelift is that a lot of times we only address the central region of the neck, where we call the double chin. But I think it's so important that we actually address the fat of the entire neckline, because that's how we make sure that the jawline definition becomes more accentuated. The other feature with her is that her chin certainly doesn't look lacking, but as we can see from the side profile, that the chin prominence is lacking, and therefore giving more of an anterior projection really does harmonize the face much better. And the result is a patient who doesn't look overdone. She only looks just younger, right? And the sign of youth really is about smoothness, balance, and certain distinctive features. This is a 30-year-old woman who presented wanting to look more younger and fresher. She feels like she's only 30, but she actually looks older. She certainly was not entertaining any type of surgery. So one of the things that stands out in this patient, her nasolabial fold is certainly deep. Her jawline definition is somewhat lacking, and her chin seems a little bit kind of heavy. So in this patient, we took neuromodulators and fillers and achieved some of highlighted areas to accentuate those areas. And then we utilized Ultherapy, which is our go-to energy-based skin tightening procedure to kind of give her more of an overall lifted look. And then we wanted to highlight especially the jawline definition with a thread lift. So let me talk about each one of them. So in terms of utilization of neuromodulators, Now, she's not one of those typical patients that has a huge hypertrophic masseters or wide jaw, but she does have some degree of that. We did inject some neuromodulators to the masseters to reduce the fullness and the width of her jaw. Then what we did was we took a filler and we injected into the nasolabial fold as well as the chin area. And we use hyaluronic acid fillers for this. Sometimes it confuses people as to what exact type of product to use. And so for her, to accentuate the chin area, I usually like either Voluma from the Juvéderm family or Restylane Lift from the Restylane family. And the reason is that they are the more firmer type of product, whether it's chin or cheek area or for liquid rhinoplasties. I do like those products. For the nasolabial fold, what we want to do is we want to inject product that is not too soft, but at the same time not too firm. The next thing we did with her was we treated her entire face with Ultherapy. Ultherapy is still our go-to first level of anti-aging treatment that we do, because quite honestly, anybody can do Ultherapy if they want just overall tightness. Then what we did to accentuate that jawline definition was we did a thread lift. And in our practice, we term this flash lift. So what we do is that we take what we call barb threads. And that means that across the thread, there are tiny little barbs that integrate into the tissue to kind of lift the tissue up. And there are different types of threads. The heavier threads, we want to try to be lifting the cheek region. And then what we do is that we take kind of a medium barb threads and we want to place it a little bit more towards the front or the anterior area, and we want to utilize that for the neck as well. We're not doing this on the neck to kind of give a neck a lift. What we're trying to do is we're trying to define the jawline. Because to do that, we need to lift above as well as below the jawline definition. And that's how we achieved a more of an accentuated jawline. So this is a liposuction case about a patient who never had any children, who is on the younger side, who has gained about 20 pounds over the last 3 years, and she wanted to get rid of some of the problem areas. And in her, it is about general sort of abdomen. And so she has some fat deposits on the upper and lower part of the abdomen, and her waistline, which she had, is now a little bit blunted. And so what we wanted to do was we want to make sure that we actually accentuate that waistline. And then in terms of the abdomen, we wanted to make the abdomen as flat as possible. The other thing with this patient is that she wanted her legs to be more straighter. And certainly her leg doesn't look bad, but she did have some fat deposit in the inner aspect of the thighs. But the other thing that sometimes gets kind of overlooked is the importance of fat deposition along the medial knee area, because that area does account sometimes for non-straight inner portion of the leg. And so these are the areas that we kind of focused on in terms of the liposuction to achieve a more straighter after effect. The type of liposuction that we performed on this patient was what we call body tight procedure. Now, body tight just means utilizing a certain energy. And these days, when we do liposuction, we never just do straight liposuction alone. We feel like the fat comes out better when you use certain energy to melt the fat first. And then also, by utilizing the energy that melts the fat, it also tightens the skin too. And so these days, there are 3 different types of energies that we use for this effect. The first is using radiofrequency, which is the body tight procedure. So radiofrequency energy we utilize to melt the fat as well as tighten the skin. The other type of energies are using laser wavelength to melt the fat and also tighten the skin, and that's called smart lipo. And then the third type of energy is called the ultrasound. So with ultrasound, it is called vaser liposuction. So these are the 3 choices that we currently have on the market that's available to utilize. The radiofrequency energy is the more newer type of modality. And we feel like we accomplish a little bit more with that in our practice. Hello everyone, this is Dr. Peter Lee from Way Plastic Surgery again. And today what we're going to be doing is that we're going to go through kind of the plan and of how we did some injections to rejuvenate a face that some people have some areas of concern. So this first patient here is a 26-year-old female who specifically is kind of like talking about, I just want to look overall more fresher and more prettier. Okay? And what are some of the ways in which we can accentuate that using non-surgical filler treatments? And so for this patient, if I kind of take a look at her, the area that kind of looks a little bit kind of ill-defined is the balance between the top portion of the face and the lower portion of the face. The top portion of the face seems a little bit more narrower, lacking more volume, whereas the lower part of the face looks a little bit more heavier. So one of the first places that we did do the filler is on the temple region, like these areas. And we also accentuated the eyebrow a little bit. And what that does is that it's kind of like slightly gives the lateral end of the eyebrow to kind of go up, as well as accentuate the eyebrow so that there is a little better connection between the eyebrow and the nose. The other area that we decided to enhance is along the submalar region here, because it was a little bit hollow. And again, just because her lower portion of the face looks a little wide, you kind of want to accentuate the top portion so that what we normally like is an inverted egg look, and that's what we wanted to kind of accentuate. And then we also did a little bit of filler along the mid-face region to fill out the hollowness that she has, not on the side, but more towards the forward area of the mid-face region. Then we also enhanced her nose. What she had was she had a hump and a tip that looked a little bit droopy. And so what we do in that case is we do a little bit of filler on the, what we call the radix, the top portion of the nose, as well as an area just below the hump. And then we also did a filler at the tip to kind of lift up the tip region, because for people with a hump, their tip looks a little droopy. And so if we kind of like fill in the tip region, then it gives the tip area a little bit of a cephalic rotation. We also decided to do a little bit of filler at the chin and a little bit on the lip as well, especially the corners, to kind of give the corners a little bit of a lift. So overall, I mean, what the pyramid rejuvenation does is that it makes you look a little bit more fresher. It also enhances certain areas where you lack that accentuation. And overall, it just gives, a patient more of that rejuvenated look. So this next patient is a 30-year-old female who just feels like overall she's looks a little tired. And wanted just overall like more of an accentuated look, to her face. And so if you kind of take a look at her, and the way that we normally assess a face is, number one, we look for balance, we look for facial shape, and then we go from top to bottom. So if I look at her top 1/3 of her face, the proportion's actually pretty good, but her forehead and her temple area looks a little bit flat. So it's not a smooth contour, but it looks a little bit irregular. So one of the first things that we did was we did fill out this area, which is the forehead and the temple region, with some fillers. And for specific areas, we use different types of fillers, but most of these fillers are hyaluronic acid fillers. And then the other thing that we did was we filled in a little bit of the eyebrow to kind of give her a little bit of a lift, as well as a little bit of an accentuation. And then her nose overall was okay, slightly low, but she was actually okay with the height of her nose, but the tip did look a little bit droopy, and the tip lacked a little bit of projection. So we injected a little bit of filler at the tip, and then you can see that she also has a little bit of eye bags under her eyes, which also highlights the emptiness of what we call the frontal mid-face region. So for people with kind of an exaggerated, what we call maxillary bone, which is the upper lip region, if that area is a little bit projecting, then a lot of times that transition point between the cheek region and the maxillary region, there's a bigger sort of that contour concavity. And so when we inject fillers to kind of like make that area more smoother, we don't really inject it like as if we're treating an aging smile line. What we do is that we inject it right on top of the bone so that the transition point between the cheek region and the maxillary bone is smoother. We also did a little bit of filler on her chin region to kind of highlight her looks like that. And so you can tell like afterwards, she just looks overall a little bit more brighter, more rejuvenated. Her eyes look a little bit bigger, and there is a little bit more of that accentuation on her jawline definition because the cheek has been filled out a little bit more. Her nasolabial fold looks a little bit more smoother. So this next patient is a 34-year-old female who feels like overall like she doesn't look as fresh, and she just wanted to look overall fresher, as well as kind of like highlight some parts of the face that she felt was underrepresented, especially the central region. So if we kind of take a look at her, in terms of large surface area that lacks some volume, she certainly lacks volume in her temple region, as well as the submalar region. And for patients who have large deficit of volume, especially in these regions, we do like to use not hyaluronic acid fillers, but more of what we call Sculptra, which is a collagen stimulant. And so the way that these works is that the product itself disappears after 6 months, but it has a long-term longevity because the way that it fills is not because of the product itself, but because of the stimulation of collagen. So in these regions, we decided to go with Sculptra, and then we wanted to highlight her eyes. And so in this area, we injected hyaluronic acid fillers, a little bit more firmer type. And then we did a little bit on her nose. And then whenever we do a little bit of the bridge, we do a little bit at the tip as well. And then we also filled out her smile line. And then another sort of major area for her that lacks volume really is her chin region. We also did a little bit on her mid-face region because of the bags that she has. And these are all done with hyaluronic acid fillers. And you can see like overall her contour looks pretty good. Sometimes we think like with fillers, like the face actually looks bigger, but it actually isn't. She looks obviously even slimmer. But what really makes a huge difference for her is that because she lacked central definition, by highlighting that central area, I mean, she obviously looked, a lot more, fresher.